Well, hello, everybody. Thank you for being with us today. It's another great day on Continence Chat. And my colleague Deanna and I are thrilled to have a new friend in our company today. I would like you for a moment to imagine what it would be like to have an advocate, a friend, really, who knows their way around the healthcare system. I personally think that might reduce stress. It might also give some peace of mind. And so today I want to introduce Michele Billings. And Michele, we would just like you to kind of give us an idea of your background, of how you got involved in this work, and what people could expect from someone that is providing such a wonderful service.
Well, thank you, Susie. It's a very nice introduction. I appreciate that. My name is Michele. I've been a nurse for 14 years. I've worked, over the years, I've worked in hospitals, clinics, you name it. And over that time, I've seen how many families are stressed. So many things fall through the cracks. They leave the hospitals and the discharge paperwork isn't necessarily informational. I've had a few patients that I've discharged, they call it just advertisements. So they don't know what to do. Testing gets, falling through the cracks. Medications, they don't pick them up. I had, for example, a lady that I worked with in a hospital. She had a stent put in her lower right leg. She came back several weeks later. Her leg was black and blue. It was awful. She didn't understand that she should have been on a blood thinner that entire time. So, and she was a younger person. It's not just solely elderly people. It's, across the board. They don't understand the care. They don't understand that they can ask questions. They're intimidated by doctors. They think, that it is what it is, kind of like, the parental thing. You take it and you go. So anyways, I can be that person, and there's many, many out there to bridge that gap. Go to the doctor's visits with them, help them understand the disease process, their medications. A lot of times people that don't have a clinical background don't understand what options are out there for them. So again, I can kind of pull things together, fill in the gap, and help the process be a little bit smoother and take some stress and work out of it for them so that they can spend quality time with their family.
Yeah, that's wonderful. You said something in your opening statement that resonated with me right away, bridge the gap. And I've learned through a healthcare background, but even more recently, some personal family members, circumstances, that when we think of physicians are their role, right, is to diagnose and treat from a medical perspective. And I think there are lots of resources out there, especially for the older aging demographic, that need the resources, but it's that point in between where I think you fit in beautifully, and I think we need 1 million of you to fit in beautifully, because a person leaves the office and often they have, okay, I've got a diagnosis, whether they understand it or not is hit or miss. And I know I've got resources, part B somewhere, but between A and B, there's so much in between. And I feel like caregivers especially are in what I call do mode. All they're thinking, my loved one just got a diagnosis, or I just got a diagnosis. What am I going to do? And it's cloudy for a period of time. And that, am I correct that that's where you would fit? Yeah.
And help them understand, we all go to Dr. Google. Everyone goes to Dr. Google. And I've worked with a physician, and he does admit that it's about 86% correct. But that's if you know what sites to look at. The general public doesn't know. And you're either going to live 150 years or you're going to die tomorrow. So helping them understand we can get through this. There are options, and tweaks in your lifestyle can make a huge difference. But I can help with all that.
Yeah.
How does somebody, I'm sorry.
No, go ahead. Go ahead, Susie. I'll have a backup question.
How does somebody ensure that their loved one receives quality care?
Do I ensure? I would go to the doctor's visits with them. Yeah. To me, if the physician or the people that they're working with are receptive and responsive, that's better care. We have a lot of physicians who they may be wonderful, but maybe their care staff in the office isn't so much. So I can be that one to kind of harass, because they do need that, And same with the home health companies. I would get involved. I network with quite a few, and I've worked with quite a few over time, and hospice companies, to make sure that they're the best provider that they need.
So when you're in the appointment, I'm picturing this like you're taking notes and you're asking questions on behalf of the patient and their family. Is that right?
Yes. And I would ask them, is it okay if I step in? Because I want this to be, especially again with the older population, to keep their independence as long as possible. But yes, I would. And maybe ask the physician to reiterate if what I'm understanding is correct, to make sure that my client doesn't think that I'm putting words into the doctor's mouth, and twisting it into something that's not. I want them to be completely confident with what they're hearing.
I'm curious because I've learned, but tell me if I'm right or wrong, but I've learned over the years that only Texas and only California have LVNs, licensed vocational nurses, versus the other states that have LPNs, licensed practical nurses. Can you I think our audience would want to know, what is the difference between an LVN or an LPN, or is there a difference? Is it strictly a licensure thing?
I don't think that there is. I think it's the exact same thing. I have a compact license, so it's not covered in California, which is strange because they're the only ones that are also LVNs. But I can work in many other states as an LVN, even though they see it as an LPN. So I think it's just a potato.
Ah, that's interesting. Okay.
Yeah.
So that's good to know too with other states. Yeah. And I know this business that you developed and the service that you're offering is fairly new, with a background in senior living for many years in memory care communities. I always am interested in learning people's passion behind it, but what led you to open up your company and do what you're doing?
Many that I've worked with in the past still stay in touch with me. For instance, I have a gentleman, he was younger when I worked with a GI doctor here in Granbury. It's been early COVID, 21 maybe. And he needed a liver transplant. Mom was going to do it. Anyways, long story short, last year, after several years later, she contacted me to let me know that he got it, and he's doing wonderful. People that I worked with last year, families that I'm not in touch with on a regular basis, they're still contacting me. So at my last community I was at, I left because I'm from that generation that I don't work moderately. I either do it all or I don't do it at all. It's how my parents were. I just can't help it when I'm working. So we had an unfortunate event in our family, and I realized I needed to step back and spend more time at home. A few weeks after that, one of the nurse practitioners I had worked with there checked in on me, asked me how I was doing, if I'd found anything else. I was like, not yet. And she said, have you thought of being just a patient advocate working directly for families? Because you would be amazing. I mean, you're already doing it. And as a nurse, we are already doing that. I thought, that's crazy. So I looked into it, spoke to a few different families that had very kind things to say about me. And again, we're still in touch with me. And they were like, yes, you have to do this. So I dug a little more and thought, this is it, because I can spend the time that I want to spend. No one's regulating or, I'm not feeling like I'm in a cattle drive and I'm having to rush people through each day. If I need to spend a few extra hours just so that they're comfortable with me, and a lot of times that's when you can get your best information, is when you're not working, so to speak, when you're just enjoying time with them. I can do that. So as I said, I either do it all or I don't do it at all. So I just jumped in waist deep, and I'm pushing through and doing my best to get some clients. So that's it. I actually recruited a few other ladies that are LVNs as well, that are trying to transition into it as well. Because again, they realize this is what we do already, so yeah.
I see a bright future, especially as more of the hospital at home programs expand throughout the country. I just think there's such, I think one of the things we learned through COVID is many people want to age longer in place at home. And so those doctor visits and medications and all of those things that you can help keep them safe at home, to me, the need is just growing.
It is. It's just massive. And yeah, how can we streamline this is the hardest part, you know, getting it out there, getting known. And there's a few sites. There's a Greater National Advocate site that's nationwide. A lot of people are on there. It's a free service where you can sign up. A gentleman that started that had a unfortunate medical accident, I believe it was about 20 years ago. And he was septic. And before they realized he was septic, it got to the point where he lost, he was gonna have to lose his arms and legs. So, and he was, if I believe right, he was an attorney. So he started that years and years ago, and it's just grown leaps and bounds. So it's getting out there. It is. It's just a slow roll. Yeah. But I agree. It's going to be huge soon.
Yeah. How far will you go? How far will you travel, Michele, from where you are based out of?
Right now, I've gone as far as Abilene, which is about 2.5 hours from here. Okay. And which I'm okay with. I've helped that family. Only met them once because they are far away, but we've managed to find a better community for his wife to live in. And with that, we've saved like $1,700 a month. We've gotten medications under control, and she's in an environment that they understand dementia, the memory deficits, and she's thriving as she should be. So family's very, very happy.
Good.
How does continence care work into part of what you do when you're assisting these families?
When we don't have memory deficits, we need to have adequate sleep. And, you know, whenever we get tired or hangry or whatever, you know, things don't click right. We don't go through our day as normal. Well, when you have a memory deficit and then you're in a place where they're told that they have to wake you up every 2 hours to change your brief, whether you're dry or not, they have to wake you up and check. That's awful. That's awful. You're never, I mean, it's hard enough. I don't know about you ladies, but, you know, menopause throws your sleep pattern totally off, you know, and then your mind isn't right and you don't understand that, you know, the time of day, and if you should be sleeping or not. Anyways, you wake them up and that throws that off even more. So with these Seni products, my gosh, when they were presented to me, I thought this is flipping amazing. I saw the presentation which nobody urinates this much, but the 4 16-ounce bottles can fit into one brief without it leaking. That's amazing. Again, if somebody dumps that much out, we've got bigger problems, but
yeah,
there's no reason that they couldn't use one of these at night and be able to sleep through the night. Yes, peek in, make sure they're good, but we shouldn't have to be waking them up. I think that would help tremendously, a little bit with their mindset, you know, each day.
Yeah. I think people don't take pause to really, we agree with you. That's part of our philosophy, right? Is let's stop the craziness of every 2 hours. And if you really, I think if people just really, I don't think it's ill will, it's lack of education, lack of understanding, and it's just habits that stem back to Florence Nightingale days. But if people took pause and really thought about, gee, welcome to our community. Have we got a deal for you? We're going to come in, you're going to pay us X number of dollars, thousands of dollars. And for the rest of your life, we're going to wake you up every 2 hours.
Right.
That is just crazy thought process. And it's not ill will. I always say that it is not ill will. It's lack of education.
Legitimate reason, but gosh, it's terrible.
I think the more we're out there and we're sharing that with people, take a pause and think, if someone said to you right today, for the rest of your life, every 2 hours we'll be waking you up. Mm-hmm. It's unfathomable. Yeah. But to your point, you need an absorbent product that works, and high density mattress and lighting and all that. But as a whole, systemically, we have all that now. So that's part of our
Amazing product.
I have another question, kind of changing topics real quick. I know when I'm thinking of family members,
Mhm.
the elderly, when they're going into an appointment or they're having to schedule appointments, there's an element of paperwork and questions and medical records that can be absolutely daunting.
Yes.
And so my question is, what would be the first steps that a family could take to organize the medical records, whether it's for their own self or for their loved one?
For themselves, that's a hard one. You know, when I first got into the nursing field, I thought it was crazy when I saw some elderly couples come in with a whole binder. It's the best thing ever. I won't get that one. So I think a few of these other advocates do this as well, have a binder, and we have everything organized. Like there's an index. Sorry, I know you can't really see this. Starting at the front, their primary contacts, we put in, if they have, which they should, we all should, financial, medical, power of attorneys. If we have an out of hospital DNR, you know, all of these things. If I'm helping them, I request that they give me access to their patient portals, and I'll print out like their last recent office visits. If I can get any, you know, some people, if they've been with a provider for a long time, we have their colonoscopy results, their mammogram results, all the things, you know. With that, I will help them build this binder and keep everything together. So as we go to each physician's office, if there's any questions, you know, they can make copies here. Because unfortunately, even though, you know, they're all supposed to talk to each other, they don't. Same with the medications with the pharmacy. You know, they may use Joe Blow for this medication, but then everything else is on their mail-in pharmacy, and they don't realize they're doubling up on the same medication. So again, I think it's amazing idea to have a binder, whether I'm working with them or not, just to keep everything together. And they need to start when they're younger, because it's a lot of stuff to get together if you wait too long, you know.
Yeah.
Even if you were healthy most of your life, there's still a lot to keep together.
Yeah.
That's a fantastic idea, and lots of great tips, because I just think, you know, in the past, maybe someone, the doctor or whoever's asking about history, and then you're trying to remember, well, what year did that happen?
Yes.
And what date did that take
Mhm.
place? Yeah.
Yeah. And I think you're right about starting younger. I think the more proactive approach that everybody can take to their own healthcare is critical. To me, it's about being able to navigate
Yes.
the process. So,
But we just need to be educated, like you said. When we're, again, I am trying to tell my kids that, but you know, kids don't want to hear it from us.
yeah. Wow.
Maybe you can tell them and they'll listen to y'all.
Yeah. And then you can tell my kids, and we'll
Yes.
put you up. And then Susie will put you into that mix with
Yes.
your kids. So.
Somehow we'll get them covered.
Yeah, exactly. Well, if you had one wish, Michele, for a change in the way that healthcare is either delivered or navigated, what would your wish systemically be?
I wish that the state, the government, whoever the powers that be are up there that control everything, I wish that they would change their patient to caregiver, whether it's a nurse or what ratio, because it's just not enough. In hospitals, especially nursing homes, you know, so many people, they're relying on that Medicare, Medicaid at the end of their life, and their only option is to go to a nursing home, because, as y'all know, assisted living, memory cares, those are private pay. There's a few of them that aren't, but still, they don't get the care that they need, because they have a 1-13 or 1-15 ratio. Well, you know, they'll help someone use the restroom and say, I'll be right back. Well, then they forget about them and they're sitting on the toilet. And same with the nurses in the hospital. I've worked a 1-4 and a 1-6 ratio, and you never stop.
Yeah.
You know, and you try to give them the best care possible. And so many, especially these elderly people and the littles, they need that. they need that one-to-one care a little bit more. So I think that should be changed. It should be mandated to be a much tighter ratio. I think we would have a better outcome and better education with all of our patients.
Yeah. And less cost overall too, right? I always feel like on the left arm is trying to save a buck, but then the right arm is spending $2 to fix the one. Whereas if you put the two over here, you'd only have the one over here.
Yeah. And the return to the ER, those visits may be lower too because they're getting educated better.
Yeah.
Because they have more time. So
yeah. Well, maybe, just maybe, one never knows on this podcast who's listening, right?
That's
and
right.
So maybe the wish will navigate.
Swim upstream.
That's right. That's right. Yeah. Well,
Yeah.
Well, listen, thank you for being our guest today. I know both Susie and I wish you wild success. You've got a great heart, a smart mind, and such a need out there that I have a feeling you're going to be very, very busy.
I hope so. Well, and I appreciate you guys having me. Thank you so much. I really do.
Our pleasure. Susie, any parting words?
Thank you. Thank you, Michele, for what you're doing. And I hope the families that need you find you quickly.
Thank you. Thank you guys so much. I appreciate your time.